All right. Good afternoon. We are so glad you could join us for today's event. This is the Together We Will Heal series organized by the Central Texas African American Family Support Conference. My name is Kimberly Holiday, and I have the pleasure as serving as your moderator for today. The conference vision is to educate the African American community on mental health, substance use disorder, and intellectual and developmental disabilities, as well as the total well being of African Americans. Through this series, we hope to continue the conversations around these topics and the public health challenges posed by COVID-19 pandemic. We hope this forum will provide the opportunity for you to participate in these courageous and sometimes difficult conversations that offer education, encouragement, and a wealth of resources to survive during these very difficult times. Today's forum is being brought to you by Integral Care and the Central Texas African American Family Support Conference. At this time, I'd like to take this opportunity again to welcome each of you here this afternoon and thank you for being here. Today's topic is health literacy and its association with COVID-19, self-efficacy and wellness self-management among African Americans in the southern regions of the United States. We have a very special guest with us today, and I'm going to quickly read her bio. We welcome her, Kimberly Keaton. Kimberly Keaton is a native Texan, nationally published writer, an art librarian and archivist, and genealogy curator. By day, the ALA Emerging Leader and Library Journal 2020 Mover and Shaker is the African American Community Archivist and Library at the Austin History Center, Austin Public Library. Independently, Keaton is the Chief Artistic Officer of Novella Media, a creative multimedia production company, and the founder of Art Library Deco. Currently, the writer is pursuing a PhD in data science at the University of North Texas. The creative considers herself to be a interdisciplinary mixologist and can be seen on a regular with her cute dog, Roxy Blue. And if nothing else, Kimberly is always taking time to read books, write hooks, and design her next. So, welcome, Kimberly, to this forum today. We are so happy to have you.
Thank you.
Awesome.
Thank you, Lady Jean Aqua and Kimberly Denise Holiday. And I would just like to say thank you to everyone who has joined us this afternoon on a Wednesday, hump day.
Yes.
As well as it's my birthday month. I turned 44 on Labor Day, so hopefully y'all got to chill a little bit. God rested on the seventh day, so it's always a beautiful day.
Awesome.
Um, so I'm ready.
If I
Uh,
could just go over a few housekeeping rules
okay.
right before we get started in order to set the platform for you. We are anxious and ready to have you, Kimberly. So just a few housekeeping rules because we are doing things not normally in the rooms as we normally do. I ask that you please mute yourself if you are not speaking, just to eliminate some of the background noise. And also, there will be times for interaction. I believe Kimberly, we set this up. She encourages your interactions. We ask that you raise your hand and then unmute yourself to talk when it's time. If you get emotional or overwhelmed, because we realize that does happen, feel free to turn off your video so that you may handle your emotions privately. And, this is not in my notes, but I always say to seek help if you need that. And last but of course not least, note that this session will be recorded and streaming live via Facebook. So smile. All right. So at this time, I would like to turn it over for Kimberly Keaton. Thank you so much again for being here.
First, I want to give a disclaimer. I am not a health professional. I am not a health librarian. I am, again, what Kimberly stated, an art librarian, but I'm a historian. So that's the beauty in all of this when we think about health. and a lot of what African American people have had to deal with since 1619 in these United States. So I am going to go into the presentation and let us begin. And I would like to say, so you would know, I like to let people know in regards to time, there are only 8 slides. And then I believe me and Kimberly will come back into discussion. Okay, so Lady Jean Aqua contacted me and asked me to put a presentation together. Honestly, I like to be honest with all of my audiences. This is the first time I've ever did a health presentation. And for me, when I put the title together, I really wanted to look at everything that's taking place in the South, but this is going to take like a part 2. So here we go. Black COVID-19, Black health literacy, self-efficacy, and wellness, self-management among African Americans in the southern regions of the United States. Oh, hold on. Okay, so let us begin. And herein lies the tragedy of the age. Not that men are poor, all men know something of poverty. Not that men are wicked, who is good? Not that men are ignorant, what is truth? Nay, but that men know so little of men. And herein lies the tragedy of the age. Not that men are poor, all men know something of poverty. Not that men are wicked, who is good? Not that men are ignorant, what is truth? Nay, but that men know so little of men. W.E. Du Bois, In the Souls of Black Folk, 1903. I thought that was a pretty profound statement when you think about what has taken place and what has been taking place since December 2019. So before I go into this next slide, I didn't make bullet points. I just wanted to just go into this with you. So where we're going to start at right now is we're going to look at history. And I would say close your eyes right now and just think about these movements: slavery, Reconstruction, the Great Migration, civil rights, and the Black Lives Matter movement. Again, slavery, Reconstruction, Great Migration, civil rights, and the Black Lives Matter movement. A brief history of pandemics in the United States. When I thought about this presentation, which again, it is much bigger than what I've created today, we have to pay homage to our ancestors, that being African American, in this case. And then we have to be very mindful of knowing what pandemics really are and what they mean in the grand scheme of history. So when you look at slavery, slavery was a pandemic, being that a body of people were taken from a continent, traveled through the Middle Passage, arrived at the Virginia colonies, some in North Carolina, some in South Carolina, some as far as Rhode Island. And I just want to give a moment of silence for them. Now, when you think about slavery, and we'll get to the 21st century, we'll get to COVID-19, I really want you to be mindful of health when you think about these different pandemics, these different movements, and African Americans. I would say unwillingly giving their bodies to others for profit, unwillingly. And this comes in different stages because there is a stage where we give our bodies away willingly. So I was looking at just what has taken place in the antebellum South in regards to slavery before emancipation. So what you're looking at on the screen is what took place in North Carolina in 1850 per the census. And just look at some of the different diseases that African Americans have had to deal with from the beginning of our time in these United States. So, for example, leading causes of death in North Carolina, according to the 1850 census, was respiratory diseases, tuberculosis, typhoid fever, diarrheal diseases, scarlet fever, measles. Then it takes you down to Virginia, and we're looking at the slave population of Virginia for 1850. Same thing. Numbers are higher though, because the vast majority of people, I would say, were sent to that port in that state in regards to being sold to different states. So from what we just saw, now that's slavery from what we just saw. Now I'm going to take you right where we are now. I was born in 1976. So this is the first time I've ever been associated or affiliated with a pandemic per se, where it's a global outbreak. So after slavery, Reconstruction, the Civil Rights Movement, brief Black history report in the United States of America. So I want to take you back to, I would say, the Great Migration, the Great Depression, and then leading into the Civil Rights Movement. Two major things occurred during that time. If you have a pen right now, a book that you might want to pick up is The Immortal Life of Henrietta Lacks. I have 2 copies in my library. Henrietta Lacks, how can I even describe this to you? She had cervical cancer and went to the doctor. They diagnosed her. And then subsequently had her coming back and forth, back and forth, back and forth. She's getting all these tests. And I would say one day, just like Fannie Lou Hamer, you wake up and her cells are missing. Those cells today are called HeLa cells, which are used in STEM research. I will let you go more into depth with that. But this is someone who gave her body unwillingly. She was going in to get diagnosed, to be treated, and ended up dying. And a piece of her body is now a part of science that she did not approve. Nor has her family received anything from the government as it pertains to her part in history in regards to the health sector. Okay, then moving forth, we look at the Tuskegee study of untreated syphilis in Black men. Now, this is where I was thinking about this morning as it pertains to Black people unwillingly giving their bodies and willingly giving their bodies, and how this correlates to Black literacy and health literacy. So during this time, of course, 1930, this is like the Great Depression. We're looking at World War II ending, or just beginning, ending, and Black people are asked to be a part of a study. And I believe, from what I've read in history, they just, wanted to help their country as well as put more food on the table for their families. But not knowing that they would walk into this and many would never walk out. A good movie that you can check out this weekend is Miss Evers' Boys, because African American people were a part of this story in regards to going to seek out these individuals to be a part of this study. Then you look at that, and let's go, maybe 20, 30 years later, we have the AIDS outbreak. I remember when that happened. Um, I remember going on TV and people saying that, this is a disease just for gay people. Then it turned into it's just about African American people. Look at these numbers today. The AIDS outbreak began in the late 1970s. And as of 2016, we have over 400,000 African Americans that have been diagnosed with this disease. But luckily, they have treatments where people can live longer lives. Fast forward to the 21st century, December 2019, no one knew what was taking place. March, everyone stopped in a moment of time, and COVID-19 is introduced to the world. Okay, so let's get into this in regards to what this is. And I will be reading from some of my notes today. I will share some of that information with you if you're interested in the literature that I have been reading. So, what is the coronavirus? Coronaviruses are a large family of viruses. Many of them infect animals, but some coronaviruses from animals can evolve, change into a new coronavirus that infects humans and can spread from person to person. But as you know, we've heard so many different stories from so many different doctors, leaders, administrators, all the way down to a local standpoint. And I mean, just yesterday, it was basically just declared, or I would say in the past month, it's been declared that it's an airborne disease. Droplets, I mean, anyone can get it based off of this. Droplets produced through coughing and sneezing, close personal contact, such as caring for an infected person, touching an object or surface with a virus on it, then touching your mouth, nose, or eyes before washing your hands. So, why is COVID-19 more deadly for African Americans compared to the rest of the population? According to the Los Angeles County Department of Public Health, COVID-19 is highlighting a history of racism today and unequal access to healthy environments, opportunities, and resources needed for good health in communities of color. Living under such conditions can make it harder to prevent and control chronic diseases like high blood pressure, asthma, heart disease, and diabetes. People with these underlying health conditions or those with cancer and uncontrolled HIV are at greater risk of serious illness and death if they get COVID-19. Now, remember, I just showed you that AIDS epidemic, so it's still trickling down also into COVID-19, as well as other diseases or ailments that affect the body. And in looking at some of the research this week, I was just astounded. I was astounded by these numbers. So this is as of last night when I went to the CDC website. Data, and this is just 4 million cases. It's actually 6 million people have this virus in these United States. So they're looking at 4,909 million people. And let's look at this right here. And I don't know if you know, but I have to find that research and put it in the next presentation. But Black people have already surpassed 1 million cases in the United States. So I really don't even know if what they're putting up on the CDC right now is factual information. But according to the website, which I do have a link in this presentation for you to see, when you look at this cases by race, 18.7% of the population Black in regards to COVID-19, 459,242 people have it. Now, jump over here to deaths, 25,398, and I know that number is much bigger. But just think about how many lives have been lost when you go to this portion. Where are their stories? Where are their histories? Where are their archives? That's the thing that I immediately think about as a librarian and an archivist. Who's going to tell their story? You know, because the vast majority of these people in this section, in regards to Black people, are, I would say, moderately between the ages of 50 to 100 that have passed, which you can go on the CDC site and look at more information as it pertains to that. But I just wanted you to see the general premise behind race, the numbers as you see, and then the deaths. And I think you should you should look at this every day because it's important information. It's important information. So where do I want to take this in the future in regards to this presentation? Let's just say that health literacy in African American communities, barriers and strategies. 87 million Americans, African Americans, I'm sorry, have low health literacy. So what does that mean? Well, I want to back up a little bit and I want to talk about and then segue back into that. So when you look at health literacy, when you look at COVID-19, we're just going to throw out these words. You can write them down. Discrimination, healthcare access and utilization, occupation, educational income and wealth gaps, and housing. These are things that affect the Black community on a daily basis. This just doesn't have anything to do with health. This is just because you're an African American and you live in these United States. Okay. Now, when you look at health literacy, I'm not going to say that to not be health literate means that you don't read books, but do you read books? According to the U.S. Department of Health and Human Services, health literacy is defined as the degree to which individuals have the capacity to obtain, process, and understand basic health information needed to make appropriate health decisions. Low overall literacy may impact health literacy. However, the relationship between them is complex. For example, an individual may have high overall literacy, meaning that you read, everything that you can think of under the sun. You have a beautiful library. But when it comes to health literacy, do you understand the insurance documents that you're reading? Do you understand, when your doctor gives you a sheet of paper and asks you to sign it, do you just sign it and just say, okay, that's the diagnosis? Or do you sit and you actually read? And if you're not cognizant of what you're reading, do you actually ask for help to gain an understanding of what you're reading? This is what health literacy is about, and what I think is also missing in the grand scheme of what we're going through right now, because so many people are so inundated with their cell phones. I don't know if you can see me, but with their cell phones, thinking this is a computer. Yes, it is, but it's a computer that only goes so far. It's meant for you to communicate with someone by talking. So when you get online and you start, a computer, which we're in front of, and you start using that computer to find information, which is active and always moving, can you find it? And can you find factual information in regards to what you may be going through just with, a shoulder ache? With respect to health insurance, consumers must navigate technical guides, understand cost sharing terms, determine whether their provider is in or out of network, and calculate copays, deductibles, and co-insurance. Like, this is all a part of signing documents. It's like going to a car, you get the car, you love the car, but you still got to sit and read all of the documents. And this is what I'm looking at in research in the past week or so. And I already know as a librarian that, we live in a society today where reading, I'm not going to say is necessarily null and void or defunct, but we need to encourage our community, specifically African American people, to start opening up books again and to start reading what they're putting their names on. Something else that I think that is important in regards to health literacy, wellness, being someone that is really a proponent of health and progression in your community is developing community assessments. And this is not something that you have to go get an organization for. I mean, you can start a communal food co-op just with 7 people, 7 of your neighbors. You know, we're looking to outside institutions as well to save us when we have the necessary, I would say, hopefully, if we don't, we can get the necessary help that we need in order to help our communities. And it starts with us.
I have one question for you that came up, Kimberly, if I could ask that
Okay.
now.
Hmm.
So, what role does the library play in health education?
Well, I mean, I would say when I'm looking at health education in a public library, you're typically going to have, we have a health section, of course, as it pertains to books, but are there health librarians there necessarily? No. You're talking about academia now. And you pay tax dollars, so you have every opportunity to go into UT Austin, any public institution, and the question that you ask me can be answered. So I would say when it comes to a public library setting, I would hope that, in the times that we're living in right now, that there are some health initiatives being developed and shared from a virtual perspective, such as this online. And I know, there are different sections within public libraries where they do offer health pamphlets, and basically giving you resources that are within the community as far as your community that you reside in.
That's a great, thank you so much for that. Because people were wondering, especially right now during COVID, if you're not able to get out to the library much, where else might you find some of this very important, crucial information that you were sharing with us at this time?
And so I would say this presentation is privy to everyone. You will be able to get a copy of it. And I want to take you back to, I'll get to this because these are some really great resources. I only put 2 links because it's so many once you click on those links. But I want to take you back here. Well, here. This is something that might be of interest to you to look at in regards to the demographics, as far as gender, as far as just African American people in general, and AIDS, because this is still taking place. This is still going on in society right now, and those numbers need to be looked at. Okay, then with COVID, now first let me take you back. Well, actually, I'm gonna just stay here. So it gives you the data for race, how many people they're looking at. This is how many people they're looking at for the study. Remember, this is not how many people actually have this virus. There are over 6 million people that have this virus right now. Now, this breaks it down by age group. It goes on further and further. I just wanted y'all to see the racial component. But as far as age, it gives you that. Then it breaks it down by gender. And you can download all of this information. And it's available every single day. Every single day.
I have another question for you as well coming in.
Uh-huh.
Does the library provide any health literacy classes or forums?
Now that, okay, I want to be clear that I work at the Austin History Center, Austin Public Library, so I'm more into research. But what I will say about the Austin Public Library, I'm more than sure that they should be hosting forums such as this and have literature available. If not, I would say something about it. But more than likely, I believe they should have some of that information up. Um, as it pertains to, across the board in these United States, I believe that libraries are really doing the best that they can in regards to educating the public about COVID-19. And then you have to look at the standpoint that most librarians are working remotely right now. So, where do you go get that information? The best resource I'm going to tell you right now is the CDC. And we're going to always refer you back to this because these are facts that they're giving out to these United States. They're giving, to us in real time. Um, I would say that when you look at academic institutions, it would be the same thing because pretty much everyone is working remotely. So I will offer you my email address. And if you have any questions today that I can't answer today, I will take the time to email you personally and provide you with an answer.
All right. So I do have some pressing questions coming through our Facebook. If you could talk to us specifically about how COVID is affecting our Black communities right here in Austin and Central Texas. If you could speak to us a little bit about that.
So, as it pertains to Austin, the demographic that is facing the most statistics right now would be Latino people. Um, that's not to say that African American people are not in danger in Austin, Texas, but I would say that um, in Austin, per se, Latinos pretty much are taking the biggest hit as it pertains to COVID-19 right now. As far as Central Texas, um, it would just be people of color in general. And when you're talking about Central Texas, I'm believing you're talking about Houston, you're talking about Austin, Dallas, Fort Worth, and San Antonio.
Correct. Thank you. And why do you feel that us as African Americans have so little information about health literacy?
Okay, could you repeat that again? I'm sorry.
So the question is, just as African Americans, like, why do you feel like we receive less information or we have less resources to health literacy? You mentioned, I know for me, you mentioned like when we receive forms at the hospital, do we really understand them? So the question is, why do you feel that there is a lack for us in the understanding or with health literacy just in general?
Well, I mean, you have to go back to history. All this is history, and we must know our history. When Black people were enslaved, Black people were told they could not read books. That hasn't left our psyche. I'm a librarian. There are only, what, 300,000 librarians in the country, maybe 350 now. Out of 350, there are only 40,000 Black librarians in the country. That's for a reason.
Hmm.
So the same thing still stands today. This is all about history. This is history, and it's repeating itself. This is nothing new. This is nothing new. When you look at these three movements right here, this is nothing new. Nothing new at all. It's just, do you know your history and what are you going to do different as an individual during this time? Are you going to take the time out to learn more about your history? And that goes into genealogy and what your health background looks like from a genealogical standpoint. And I think that's very important right now. So you know what you are dealing with in regards to your own life. But when people ask me those questions that you just asked me, Kimberly, like, you have to know your history. If you do not know your history, then, how can you go back to the past
That's
to be
good.
present in the future, to even know what to do with COVID-19? Because you have to look at these different movements. Like, it was just startling to me because I didn't know how I was going to approach any of this, because I'm going through it too. I mean, from literally.
Absolutely. And so, how do you feel that we can change people's attitudes in general about health literacy? Because you've got us all excited today about it.
Well, and okay, well, I guess no, because I have one more slide to show.
Okay,
But
I'll let you finish that.
um, I think that, you know, how can I say this? All my friends read books. That's my hashtag. All my friends read books. So if you don't read books, I really don't talk to you, because it's the greatest gift in life that you can have. Now, when it comes to comprehending and interpreting information, if you don't understand that, that's when the educator comes in. I don't understand everything that I'm learning, you know, all the time as a PhD student, but that's why I have professors to go to. We have to reach out to those people and be okay with that. Like, in regards to health literacy, in regards to literacy, in regards to learning about anything, we should all be lifelong learners. And you should never think that you know everything, because you don't. Because we definitely don't know anything about COVID-19, and nor do I really think, in doing all of my research, that, I really don't think they know what's going on still. I really don't. I think they're still trying, it's trial and error. How long do we have? I give it to 2022 before you'll be able to really get on a plane and be comfortable with yourself without a mask on. Maybe. And that's just based off of the research that I've done in a week. Um, so I want to show you these resources real quick. This is from the American Policy Forum, which is an excellent resource if you want to learn more about what's going on in regards to African Americans and the Black Lives Matter movement. If you need resources from a political standpoint, this is the place to go. But this is just a comprehensive listing of just resources as it pertains to COVID-19.
Let me see, there's another question coming in. What can the community do to encourage each other to be literate about our health, especially mental health? Great question.
I think that, leading by example, you know, um, how, like, back in the day, grandmothers, they would host church in their house. You can host a health literacy party in your house. You can invite your girlfriends over, some teenagers over, and y'all have like a little health initiative party, and you share your wisdom with the young ones, and the young ones ask you questions. And then if it's just, you know, a group of grown folk, then let's just talk about it. We don't have to be in a church, because the church is just a building. That's just a building. But when the walls are gone, what do you do? And I think we've been shown up in this world by the Spirit being Jesus. Lord, thank you. But I think that needed to happen during this pandemic, because people need to understand that the building is just a building. But what are you going to do when the building's gone? So if you're asking me about health literacy in African American communities, the Black church is a powerful resource for health literacy initiatives. It should be.
That's right.
And it shouldn't just be when I'm paying my tithes. It shouldn't just be when the doors are open. It should be going on right now. They should be having all kinds of health forums right now while we talking
That's right, Kimberly.
online.
That's a whole nother workshop right there. And especially because I can only speak for myself. Many of us, I have lost my insurance as a result of the pandemic. And so it made me get very health conscious, watch what I'm eating, just so I could take care of myself in the gap, in the meantime, until my insurance starts back up. And I know I'm not the only one in this situation. So I know COVID has encouraged me to get very serious about my health and health literacy for myself and my family. It's actually going to save our lives. I'm trying to be true to time. And so it looks like we
Okay,
have,
I'll stop
do you have another
sharing. Well,
slide?
let me click on this one last link.
Yes,
And
ma'am.
this is austinjustice.org. Um And this is, hold on just a second. This is another great resource where they just list out, different resources that you can get. It's organized really well. I really like it. Of course, there are more, but this is one of the good ones, I think, because they also focus on race. They focus on what's taking place outside of health as well. Um, and let me stop sharing. Okay.
Wow. First of all, we want to take this opportunity, Kimberly Keaton, to thank you for such a thorough workshop with us today. I know it was a wealth of information, and I could feel your joy and excitement, and also trying to figure out which part of it do you give us, because it isn't just a 1 hour topic. And the truth is, we have to go back to our own history in order to understand where we are today and how all of these systems are working together. And the truth is, information is knowledge and wealth. And I want to make some deposits into myself. Being true to time, I want to make sure that I have Lynn. If you want to unmute yourself, we would love to have you speak at this time to share with us.
Hey, y'all. Yeah, thank you so much. What an honor to be here and just to follow Ms. Keaton also. That was such a wonderful presentation. I'm so grateful for all that history and all that knowledge. Yeah, and I love the idea of a health literacy party. I think that's amazing. So my name's Lynn, and I work at Foundation Communities, and our health coverage program is actually listed on that austinjustice.org resource list that Ms. Keaton mentioned. And what we do is very specifically work in health literacy, and we work in all kinds of different health programs and help people fill out their applications for things like public health insurance or the Children's Health Insurance Program or Medicaid. We have partners at the Area Agency on Aging for people who have questions about their Medicare applications. We also work with veterans who have access to TRICARE, because all these systems are so big and they're so interwoven and so complex that it's difficult for people to know even which ones they fit into and how to get into them and what their eligibility is for different programs. So we would normally meet with folks for about an hour at a time in person, and we would talk about what people's family sizes are, what their immigration statuses are, what their family incomes are, and we would talk with them through their best options in health coverage. Now, for some people, like for folks who are undocumented, they don't have access to health coverage in the United States through the public marketplace option, but we do help them nonetheless figure out where the local federally qualified health centers are that are close to them so that they can at least have access to preventive care that can help keep them outside of emergency rooms if something were to happen to them that would require long-term care. So we work with literally the entire population. And I just want to say out loud that like one of our big goals is to reduce the number of uninsured people of color in Texas. Like that is a huge, huge population of folks that oftentimes because they're not targeted in advertising or because they don't have connections to the same types of educational spaces or even workspaces, they don't have the same kind of information that other people have about access to healthcare. So our office right now is we're focused on the open enrollment period for 2021. But that said, if people qualify for mid-year enrollment, like Ms. Holliday, who said that, when she got furloughed from her job, if you lose health coverage through an employer, most people qualify for special enrollment or what's called mid-year enrollment into a public plan. And we are around to help people make those mid-year enrollments happen in 2020 also. So my information is in the chat. I would love to be part of a health literacy party. I would love to be part of a health literacy conversation, forum, web forum, what have you. And our goal, like I mentioned, is just to make sure that people in Texas, and we're certified to help people across the state of Texas, is to help them get the best coverage possible. So yeah, definitely reach out to me. I nerd out over health insurance. I'm so glad that this conversation is happening and that people are paying attention, especially right now when it's becoming so evident the great health disparities that can arise, or not arise, but like just be amplified by crises like the pandemic. Thanks so much again for this opportunity to talk. And Ms. Keaton, that was just such a mind-blowing presentation. I'm so grateful. And yeah, y'all reach out to me, or if anyone has questions now, I'd be happy to answer questions right now too.
All right. Thank you so much, Lynn, for that. We really appreciate that. And right now, I've asked that we unshare screen, which we have. If you want to turn on your cameras, this is our question and answer section. Any comments? And also, we have a raffle for those of you who have joined us today, $25 giveaway. I checked the list. I was like, is my name on there?
Go get you some fruits and
Woo-hoo!
vegetables.
There's all
Yes.
these things I can do with $25 that will
Oh,
make me
yeah.
feel much better today, right? And this is about mental health. So at this time, I think I've answered most of the questions that came through via our social media and or here on the chat line. And Dr. Keaton, you've done a really great job.
Dr. Keaton already. Thank you.
Hey, we're claiming that thing.
Oh, amen. 2024 people.
Absolutely.
Yes.
So, criteria. Oh, yes. Lady Jane reminds me that the criteria is, of course, that you have to be here to win. So we're about to wrap that up. If you are on the screen and you are under the sound of my voice at this time, I believe we're ready to do our raffle. So if there's no further questions, again, Dr. Kimberly Keaton, we are so honored to have you here as a part of our family here of the Central Texas African American Family Support Conference. The forum is something that we do every month to educate our people, and you have set the platform for us at this time. And
And
again,
I wanted to add one more thing about self-care, because I didn't get to touch on self-care and wellness. If you're over the age of 25, you should already be loving yourself. Nobody should have to tell us to love ourselves. No one should have to tell us to take 30 minutes a day to do something with self. And please know that I'm working on this with myself as well. During this pandemic, please remember this. You're in a pandemic. You owe no one your life. You are in a pandemic right now. Take time out for yourself. Enjoy life as much as you can, because it is not promised. My mother died when I was 38 years old, and that was not during a pandemic. I had to jump on a plane and say goodbye to my mother at 38. I'm 44 today. Okay, enjoy life. It is precious. And I think we're walking away from that, where we're starting to move fast again. Everything's just going fast, and I got to get this done, and I need this presenter, and I need this. No, you got to stop, and you really got to realize what's going on. Until we are not wearing masks anymore, people, we are in a pandemic, and you need to take it seriously, very serious. Self-care is what makes you feel good. It just shouldn't be a bubble bath. Okay?
that was pre-pandemic self-care. It looks a whole lot different, Dr. Kimberly, now during the pandemic. Yeah, that was some really good information. Again, we thank everyone, and yes, everyone's calling you Dr.
I
Kim.
know.
Chat. It's not church, but they say when 2 or 3 are gathered in my name, there
Thank
shall
you,
also be.
Kimberly. I appreciate it.
There's about over 20 people on the screen. So, Lady Jane, if you want to get ready, we are ready to do our spin the wheel and name a winner. Rosa said that this is one of the best. Let me go back to that. I want to make sure I read that. Rosa said that this is one of the best webinars I have attended. I'm so happy I signed up. Thank you all. Registered nurse, Rosa. So thank you for being here. And yeah.
I loved it.
Thank you.
Thank you so much for being here. And we hope we do this. I want to let everyone know, if this is your first time being here, welcome. We do the forum every third Wednesday at 1:30 every month leading up to the conference. As we get closer to the conference, we may decide to do them maybe 2 times. Again, this is about a wealth of information and knowledge. Spin that wheel. We should have some music or something playing. Ta-da. Here we go.
We
You must.
are family.
I got all my sisters, brothers, and me.
We are family.
We have a winner. Marjorie Douglas, are you here with us today?
And my mom's name was Margie. Marjorie.
Is Marjorie with us today? I can't see everybody on the screen. Please speak up. If not, we're going to spin that wheel again because the
She
criteria
left.
must be present to win.
Okay.
Okay, spin it again. Here we go. We got our Vanna White in the background. Go ahead, Lady Jane.
Spinning a wheel. Ya se acabó a $25 gift card. I don't see my name here, but it is there.
Sonia, you in there? I hear you speaking. Betty Williams, are you with us?
That was my grandmama name, Betty.
That's your grandmama.
It's all black mental.
Oh, Sonia, we can hear you. You might want to go on mute.
Is Betty here?
Yes, I'm here.
We have a winner. Woo woo. Okay, unshare us. Betty Williams, congratulations. You are the winner today of a $25 gift card. Woo! Just for being present today. I want to thank you and everyone else, let you know we honor your time and we so value your presence here today. It wouldn't be what it is without you. And even though most of you have your cameras off and you're muted, your energy and your presence is still so important in order to make this go forth. My name is Kimberly Holiday, aka Lady Joy, showing up as my just myself. Dr. Kimberly Keaton, what an honor it has been to know you and to engage and to experience you. We thank you for this wealth of information. We will make sure that we share any links on our Facebook page as well. Remember, for you to watch and share later as well with your friends. Remember, actually, if you want to start a health literacy party, you probably can just share this as a watch party. Just start it there. Just add snacks. Okay, this is it for us today, guys. Thank you so much for being here. We will see you back again on next month, third Wednesday, 1:30 same time. Thank you all for being here. Have a wonderful day.
Congrats, Betty.
Thank you.
I'm going to eat with you. We can do 2 for $25 at Chili's.
Oh, for real? Dang.
Bye-bye, everyone. Have a great day.